Hello and welcome back to Speak Healthy. In today's video, we will learn about the multiple aspects of vitamin B12 deficiency. If it's your first time here, please be sure to subscribe to Speak Healthy for more videos like this to improve your health and overall well-being. Vitamin B12 deficiency, though often overlooked, is a significant health concern that can lead to a variety of physical and neurological symptoms. Vitamin B12, also known as cobalamin, is essential for the production of red blood cells, DNA synthesis, and the proper functioning of the nervous system. Despite its importance, B12 deficiency is frequently undiagnosed, particularly among certain groups such as diabetics, the elderly, and vegans. This video explores the causes of B12 deficiency, its symptoms, and the steps individuals can take to ensure they maintain adequate levels of this crucial vitamin. Causes of B12 deficiency. Dietary insufficiency. B12 is primarily found in animal products such as meat, dairy, and eggs. Individuals who follow a vegan or vegetarian diet are at a higher risk of B12 deficiency due to the lack of animal products in their diet. While plant-based foods do not naturally contain B12, some fortified foods and supplements are available to help meet the dietary needs of those who do not consume animal products. For vegans, fortified cereals, plant-based milk, and nutritional yeast are good sources of B12. Regular consumption of these foods can help prevent deficiency. It is essential for those who avoid animal products to be mindful of their B12 intake and consider regular blood tests to monitor their levels. Malabsorption issues. Various medical conditions can impair the body's ability to absorb B12 from food. Pernicious anemia, for example, is an autoimmune condition that affects the stomach lining and reduces the production of intrinsic factor, a protein necessary for B12 absorption. Without intrinsic factor, B12 cannot be efficiently absorbed in the small intestine, leading to deficiency. Other gastrointestinal disorders such as Crohn's disease, celiac disease, and atrophic gastritis can also lead to malabsorption of B12. Individuals with these conditions may need to take B12 supplements or receive injections to maintain adequate levels. Medications. Certain medications can interfere with B12 absorption. Metformin, a common medication used to manage type 2 diabetes, has been shown to decrease B12 levels in some individuals. Long-term use of proton pump inhibitors, PPIs, and H2 receptor antagonists, which are used to treat acid reflux and other gastrointestinal issues, can also impair B12 absorption by reducing stomach acid production. Stomach acid is necessary to release B12 from food, so reduced acid production can lead to deficiency over time. Patients on these medications should have their B12 levels monitored regularly and discuss supplementation with their healthcare provider if necessary. Symptoms of B12 deficiency. B12 deficiency can manifest in a variety of symptoms, ranging from mild to severe. These symptoms can affect multiple systems in the body, including the circulatory, nervous, and digestive systems. Pale and jaundiced skin. One of the most noticeable signs of B12 deficiency is pale or jaundiced skin. B12 is essential for the production of red blood cells, which carry oxygen throughout the body. A deficiency in B12 can lead to the production of abnormal red blood cells that are larger and more fragile than normal. These cells are more prone to breaking down, leading to a reduction in red blood cells, anemia, and the release of bilirubin, which can cause a yellowish tint to the skin and eyes. This symptom is particularly concerning because it indicates that the body is not receiving enough oxygen, which can lead to other serious health issues. Weakness and fatigue. Another common symptom of B12 deficiency is persistent weakness and fatigue. This occurs because the body lacks sufficient red blood cells to transport oxygen effectively to tissues and organs. As a result, individuals with B12 deficiency may feel constantly tired and weak, even after adequate rest. This can significantly impact daily life, making it difficult to perform routine tasks and maintain an active lifestyle. Chronic fatigue can also lead to mental health issues such as depression and anxiety, compounding the effects of B12 deficiency. Neuropathy. B12 plays a vital role in maintaining the health of the nervous system. A deficiency in B12 can lead to nerve damage, resulting in symptoms such as numbness, tingling, and a pins and needles sensation, particularly in the hands and feet. This condition, known as peripheral neuropathy, can significantly impact an individual's quality of life. The nerve damage caused by B12 deficiency can also lead to more severe complications, such as balance problems and increased susceptibility to injuries. Balance problems. Nerve damage caused by B12 deficiency can also affect balance and coordination. This is especially prevalent in older adults who may already be experiencing age-related degeneration in their nervous systems. Poor balance can increase the risk of falls and injuries, making it a critical symptom to address. In addition to physical injury, balance problems can lead to a loss of independence and a decreased quality of life. Lesions on the tongue. Glossitis, or inflammation of the tongue, is another symptom of B12 deficiency. The tongue may appear swollen, red, and smooth, and individuals may experience pain or discomfort while eating or speaking. In some cases, mouth ulcers may also develop. These lesions can make it difficult to eat a balanced diet, leading to further nutritional deficiencies. Shortness of breath. Anemia resulting from B12 deficiency can lead to shortness of breath and dizziness. Without enough red blood cells to carry oxygen, the body struggles to meet its oxygen demands, causing individuals to feel breathless even during mild physical activities. This symptom can be particularly distressing and may lead to reduced physical activity and fitness levels. Blurry vision. B12 deficiency can also affect vision. The optic nerve, responsible for transmitting visual information from the eyes to the brain, can become damaged due to lack of B12. This can result in blurry or disturbed vision, which, if left untreated, can lead to permanent damage. Vision problems can significantly impact daily life and may lead to accidents or injuries. Regular eye examinations and monitoring of B12 levels are essential for individuals at risk of deficiency. Mood disorders and depression. B12 is involved in the synthesis of neurotransmitters, which are crucial for mood regulation. Deficiency in B12 can lead to mood changes, including depression and irritability. In severe cases, individuals may experience memory loss and cognitive decline, further emphasizing the importance of maintaining adequate B12 levels. Mental health professionals often check B12 levels in patients presenting with mood disorders to rule out deficiency as a contributing factor. Addressing B12 deficiency can lead to significant improvements in mood and cognitive function. Solutions for preventing and treating B12 deficiency. Preventing and treating B12 deficiency involves addressing the underlying causes and ensuring adequate intake of the vitamin through diet and supplementation. Dietary adjustments. For individuals at risk of B12 deficiency due to dietary choices, incorporating B12-rich foods into their diet is essential. Meat, dairy, eggs, and fortified plant-based products can help maintain adequate B12 levels. For vegans and vegetarians, fortified cereals, plant-based milk, and nutritional yeast are good sources of B12. Regular consumption of these foods can help prevent deficiency. It is also important for individuals to educate themselves about the signs and symptoms of B12 deficiency and seek medical advice if they suspect they may be deficient. Supplements. B12 supplements are available in various forms, including tablets, capsules, and sublingual, under-the-tongue formulations. For those with difficulty absorbing B12 from food, high-dose oral supplements or injections may be necessary. It is essential to consult with a healthcare provider before starting any supplementation regimen to determine the appropriate dosage and form. Regular blood tests can help monitor B12 levels and ensure that supplementation is effective. Managing medical conditions. Addressing underlying medical conditions that contribute to B12 deficiency is crucial. For individuals with pernicious anemia, regular B12 injections may be necessary to bypass the need for intrinsic factor. Those with gastrointestinal disorders should work closely with their healthcare provider to manage their condition and ensure adequate B12 absorption. In some cases, treating the underlying condition can improve B12 absorption and reduce the need for supplementation. Medication review. Individuals taking medications that interfere with B12 absorption should discuss their concerns with their healthcare provider. Alternative medications or additional B12 supplementation may be recommended to prevent deficiency. It is important to weigh the benefits and risks of long-term medication use and explore options that minimize the impact on B12 levels. Regular screening. Regular screening for B12 levels is important, especially for individuals at higher risk, such as the elderly, vegans, and those taking medications like Metformin. Early detection and intervention can prevent the progression of symptoms and long-term complications. Healthcare providers should include B12 level checks as part of routine blood work for at-risk populations. Educating patients about the importance of regular screening can help ensure early detection and treatment of B12 deficiency. B12 deficiency is a potentially serious condition that can have wide-ranging effects on the body. By understanding the causes, recognizing the symptoms, and taking proactive steps to ensure adequate intake and absorption of B12, individuals can prevent deficiency and maintain their overall health. Dietary adjustments, supplementation, and regular medical checkups are essential components of managing and preventing B12 deficiency. And that wraps things up here. If you liked this video, please feel free to give it a thumbs up and don't forget to subscribe to Speak Healthy for more awesome content like this. Thanks for stopping by.